Welcome, everybody. Thank you for tuning in. I am Joseph Ward. I am the health educator and outreach specialist for Neighborhood Medical Center. And I'm here with a special, dynamic young lady who is a beacon in our community. And she's going to help us learn more about PEP and PrEP today, what that is. Dr. Brianna Journay is here with me. Thank you for being here with me, Dr. Journay.
Thank you so much for having me.
Oh, no problem.
So I'm Dr. Brianna Journay, like you said,
Mhm.
and I am an HIV pharmacist. I also teach in the College of Pharmacy at Florida A&M University.
Okay. Thank you. We're here to have a conversation about PEP and PrEP.
Yes.
All right. So for a while, it's been a lot of information within Tallahassee, but around the nation. But we do want to focus on here in Tallahassee about these new drugs out, PEP and PrEP. I remember when it first came out, when we first heard about it here in Tallahassee around 2013, 2014, I heard about it in the streets.
Mm-hmm.
And so it was like, hey, we have this new drug that can stop the transmission of HIV. So as a HIV prevention professional, I was like, well, no, I haven't heard about that. But that's why we're here today, to be able to clear up some myths and some misconceived notions about what PEP and PrEP is. And you are one of the pharmacists in the city who's actually been able to go out and do a lot of educating on PEP and PrEP. So definitely glad to have you here with your expertise.
Thank you. So first, PrEP and PEP, we hear that
Right,
a lot. What
right.
exactly does it mean?
Yeah, exactly.
So PrEP is pre-exposure prophylaxis. Okay, and PEP is post-exposure prophylaxis.
Okay.
So pre-exposure, clearly you're trying to prevent yourself from contracting the virus before you've even been exposed to it.
Right.
Post-exposure, you've been exposed to it already, and so now you're trying to figure out, how can you stop the virus from pretty much replicating in your body.
Okay.
So the way I tell patients or talk to people about it is kind of think of it as birth control.
Okay.
Right.
Right.
So PrEP, you're preventing it before you've even come in contact with HIV.
Right.
Birth control, you're taking it every day, preventing it before you've even had that sexual contact.
Okay.
PEP is kind of more so like Plan B.
Okay.
So
the 72 hours.
The 72 hours. You've
Okay.
already had sex, and there is a chance that you can contract the virus. So you then take that regimen that you need for post-exposure prophylaxis.
Okay. So you gave us a foundation of what PEP and PrEP is, right? So let's say I'm a person who needs to access PEP and PrEP, or I just found out about it. I just came out of a situation where I need PEP and PrEP. So how do I, as a client, actually access PEP and PrEP?
Okay. So first, if you've been exposed, and this is post-exposure, so you've already been exposed, it's very important to make sure that you go to the agencies I'm going to tell you about soon, because the sooner you go, the more likely the medication is going to work. So you have up to 72 hours to take the first dose. That's not 72 hours to see your doctor. That's not 72 hours to schedule an appointment. That's 72 hours to actually put the pill in your mouth.
And is that with PEP and PrEP, or just PEP, or just one of them?
So this is just PEP, post-exposure, because pre-exposure, you haven't even been exposed to it. So it's whenever you start taking it is when you start taking it.
Okay.
So yes, you have 72 hours, but of course it's more effective the sooner you take it. So if you are exposed to HIV, then you need to go to either Neighborhood Medical Center. They have 6 locations, and you can go on their website, neighborhoodmedicalcenter.org, to look for those locations that are closest to you. Bond Community Health Center, which is on the south side as well. And then we have CarePoint, which is also on the south side on South Adams Street, right across from where that Dollar Tree is, where it used to be Walgreens. And then also you can go to the health department, the county health departments, any location. Someone should be able to help you, but the main location, of course, is the one on Old Bainbridge. And I believe those are all the agencies that provided it that I'm thinking about in my head. Of course, if it's an emergency situation, it's a weekend, those agencies aren't open. You can go to the emergency room, TMH, Capital Regional, those sorts of places. But of course, going to the community centers are a little more easier because, especially for those who are underinsured or uninsured.
All right, so I'm gonna back this up, but bring it back to where we are now, because, like I said earlier, when I was first, when I first became knowledgeable about the existence of more so PrEP than PEP, like I said, it was displayed as this drug that's going to be the drug to stop HIV from happening. So that kind of rose into this question: is how does PEP and PrEP, and you can do one by one, but how do they actually prevent the replication of HIV in someone's body?
Okay. So HIV, if you don't know, it's a virus that attacks your CD4 cells. Okay. So it attaches itself to the CD4 cell. Then that viral RNA has to transcribe itself to viral DNA.
Okay.
Then it transcribes from the viral DNA into the CD4 DNA.
Okay.
So once the CD4 cell, which your cells in your body are always replicating themselves and their DNA. So when it replicates its DNA, it's replicating the viral DNA.
Right.
Okay. And then that is pretty much the virus then goes off, matures, and goes into your body and goes and attacks the next CD4 cell. Once it's done with that CD4 cell does die.
Right.
Okay. So the medication is working at the point where the viral RNA is trying to switch over from RNA to DNA.
Okay.
Okay. So it's pretty much stopping it at that point. So
okay.
Yes, the virus has possibly attached to your CD4 cell, but if it can't transcribe its DNA, then it's not going to be able to replicate.
And just for like layman's terms, when you're saying transcribe, you're not saying like writing stuff out. Like how do you break that down?
It's not writing it, but to, I guess, say it in layman's terms, it's pretty much, it's a genetic code.
Mm-hmm.
So it's changing its genetic code from RNA to a DNA strand. Okay. So then that way it can replicate into, with the CD4 DNA.
Right. Okay.
So it's a genetic code. I don't really know how to say it in terms.
But it's
saying it's transcribing,
right.
But that's exactly what it's doing in your body.
Right. So it's not the fact that this drug is just going to stop HIV from happening, but you're saying at a specific point in the virus entering into the cell and trying to stay alive, this medicine will not allow it to stay alive in a specific cell.
Right. Okay. So viruses need a human host to stay alive. Right. So the medication is stopping it from even replicating and being able to stay alive. Therefore, you're not, it's stopping you from contracting the virus.
Okay. So you told us about the agencies that do provide PEP and PrEP. So I go into these agencies and let's talk about the process to actually access PrEP and PEP when we go into these agencies. So I go into an agency, somebody tells me about PrEP. I want to take it because I think my behavior is to a point where I need to take PrEP. So when I get into these agencies, like what's the actual process from start to finish that will help me be able to access PEP and PrEP?
So one thing, let me take a step back. So I think it's important to understand who's eligible, right? Who should be taking
PrEP. Right.
So in short, everyone is eligible to take PrEP, which is pre-exposure prophylaxis to prevent them from contracting the virus. But more specifically, of course, we're, looking at those with risky sexual behaviors. So if you've had unprotected sex and you're having unprotected sex with multiple partners, or if you're having unprotected sex with someone who is having unprotected sex with multiple partners. And that's also women and men. Okay. So it's not just men who have sex with men. Okay. It's also heterosexual women and also heterosexual men. Okay. Also, if you are an injection drug user, so if you share needles or if you are sharing something where blood is going to be involved, right? Then that's another place where you would be, eligible for PrEP.
Okay, and this is assessed when you're accessing PrEP.
Yes. So when you come, they are going to do an HIV test. Okay. Because it's important to understand in order to start PrEP or PEP, you have to be HIV negative. Okay. Okay. So whoever is taking PrEP, whoever is taking PEP, they do not, as of that, at that moment, have the virus. Right. Okay. So they have to be HIV negative. They are going to do a questionnaire, ask you about your behaviors. They're also going to do some blood work on you. They have to do some lab work. They're going to test you for other STDs as well. Okay. And they have to check, your kidney function, your liver function, those sorts of things, just to make sure that it's up to standard before you take a medication. And then once you do that, the doctor will prescribe you, if you meet all the criteria, the doctor will prescribe you and you can pick it up at, if you have insurance, you pick up at your local pharmacy. If you don't have insurance, some of the agencies do provide it. Okay. And then what is important is that you have to make sure that you're following up. So especially for PEP. So say, for instance, you've had, sexual intercourse and now you're looking for that plan B and you're trying to make sure that you don't contract the virus. So you go within that 72-hour window. They're going to do the same thing with PrEP. They're going to ask you questions. They're going to do blood work. They're going to test you for other STDs. Okay. But it's important that you follow up to make sure that you do not have the virus, because it does take, up to 12 weeks for the virus to actually show up with the test that we're testing with. Right. So there's a possibility that, you still, if you've been exposed, you can still have contracted the virus.
Mhm.
We just won't know that until
Right.
the antibodies show up.
Right. So
Okay.
that's why the 3-month testing periods are stressed.
Very important, right?
Okay.
So follow up is very important. So if you're in a relationship and you're on PrEP and your partner is HIV positive, and you're taking PrEP to protect yourself, it's important that just like your HIV positive partner is going to the doctor to get checked up, you need to do the same.
Right.
Every 3 months. You get those same labs. They're going to redo your HIV test just to make sure that you have not contracted the virus, and even with PEP.
Right.
So PrEP, you kind of take it indefinitely, right, until you feel like you maybe something
Right.
in your life has changed.
Right.
PEP, you're only taking it for 28 days.
Okay.
Okay. So after that 28 days, or you can say month, after that month, you need to make sure that you're following up to get another HIV test.
Okay.
And then after you take the medication, you still need to follow up in 3 months just to make sure that you have not contracted the virus.
So even if I'm taking PrEP or if I've discontinued my use of PrEP, I still need to follow all of the safe sex regimens that are put out to ensure the maximum protection, even if I just got off of the medicines.
Yes.
Okay.
So even while you're on the medicine, if you're taking PrEP every single day, you still need to use condoms. Nothing is 100% effective. So yes, it can, help you. It decreases your chances of contracting HIV by about 92%.
Okay.
But that's not 100.
Right.
So we do encourage you to still use those safe sex practices, making sure that you are using condoms. If you share needles, making sure that you are not, and you're finding ways to get clean needles.
Right. But like you said, PEP and PrEP in itself, but more so PrEP on the front end. It's not one of those things you can take and just, I don't have to protect myself or anything.
Right.
It's mostly to prevent the transmission of HIV and other STDs.
Right. So it does not protect you from other STDs.
Okay.
And I think that's what some people, forget about.
Right.
They think HIV is the only thing they need to worry about. When in reality, you need to worry about syphilis, chlamydia, gonorrhea, herpes. Herpes is very, very common. Just because you don't have HIV, you can contract these other viruses, and also when you contract those other STDs, you're more likely to be able to contract HIV as well.
Okay. So I'm taking PrEP. How do I? Because you already talked about using it in conjunction with condoms, but what other things should I do as a person who's taking PrEP to make sure I get the maximum protection from HIV transmission?
So definitely whenever you have a new partner, you and your partner should go get tested, or you should encourage your partner to get tested. If you're not in a monogamous situation, then that's completely fine. However, you do need to make sure that you are able to sit down and have a conversation with those people that you are having sexual contact with. So definitely using condoms, definitely making sure that you're taking the medication every day, at the same time every day.
Okay.
So if you want to take it every morning before you go to work, that's fine. Just continue doing that.
Right.
We want to make sure that if you have a partner who is HIV positive, that they're taking their medications, so that they can get down to undetectable, and it'll be very hard for them to transmit the virus.
2 questions real quick. What happens? The first is, what happens if I don't take my PrEP at the same time every day? Will it decrease, or will it eliminate the protection factor, or will it just significantly decrease the protection factor?
So when you first start taking medication, it's going to take a while for it to reach peak efficacy in your body. Okay. So with PrEP, it takes about 20 days for it to reach peak efficacy, especially in women. I'm thinking about vaginal tissue.
Okay.
And men who have sex with men in the rectal tissue, it takes about 7 to 10 days for it to reach maximum efficacy in your body. So when you're taking it every day at the same time, that drug is metabolizing and breaking down in your body at a certain rate. So when you're taking it at the same time, you're making sure that same amount is in your body at any given time. So if you do miss a dose, say if you take it in the morning, you go to work, you forget, you get off work, you come home.
Right.
Definitely take it. Take the medication. Make sure that you're taking it and it's in your body. But it can just decrease it a little bit. But once you've been taking it for a while, you'll be fine. But if you want to get that maximum 92%, deep risk reduction, then you want to definitely make sure you're taking it.
And so that kind of take us into the concept.
And I'm sorry.
Go ahead.
That's with any medication.
Okay.
So not even just HIV medication.
Right.
Any medication that you take, you should be taking it at the same time every day.
Okay, y'all heard it right here. So 2-1-1 dosing.
Mm-hmm.
I don't know about it. Most people don't know about it. You're the expert. What is 2-1-1 dosing, and how does that complement the information you just gave about taking your medicines at a certain point every day?
Okay, so it's a little controversial. So for those who don't know, 2-1-1 dosing is a kind of a study that they're doing in San Francisco, and they're trying to see if those people who may not have sex on a consistent basis and don't want the pill burden of taking this medication every single day, can they take it, plan out their sexual encounters and take it prior to them having sex? So what they're doing is they're saying, okay, you take 2 pills on the day before you plan to have sex, and then the day you have sex, you take a pill that day, and then the next day you take another pill.
Right.
Because of what I just told you, as far as how medication works in your body and how long it takes to reach peak efficacy, I personally, as a professional, would not recommend it.
Right. So you recommend taking your medicines
I recommend
on
taking
schedule
it every day. And of course, like you said, they're doing a study. So there's nothing that's been approved by the FDA. The company has not said that's how we want our drug to be used. That's not how it was studied. But there are people in the community that have heard about this, and they're starting to do that, to say, okay, I'm going to plan and I'm going to take these 2 pills and then I'm going to have sex tomorrow. But how often does that really happen? How often do people or can people really plan when they're about to have sex? So I would just say it's better to be safe than sorry, and to take it how it is prescribed and recommended by the FDA.
But this is just something they're looking at to possibly introduce in the future.
Possibly in the future, yes.
So with that being said, I know a lot of people want to know, if I'm taking PEP or PrEP, what are the side effects? How does it affect my body?
Okay. So the side effects, as seen in clinical trials, were very minimal. They were maybe nausea, headache, abdominal pain.
Right.
From experience and from speaking to people, those side effects will kind of wear off. So it takes your body some time to get used to something when you start taking it. So I will say those side effects definitely wear off after maybe the first 2 weeks. If you even have those side effects, but they're pretty minimal, nausea, headache, abdominal pain.
Okay. And so let's say I have a friend or I have a girlfriend, whoever, and I feel like my activity is very risky, and I know this person has PrEP, and I haven't necessarily gone through the process to access PrEP properly. Can I just take somebody else's PrEP? And if I do, will that PrEP be, will it work at its maximum efficacy in my body?
Okay. So PrEP, which the drug for PrEP is Truvada.
Okay.
We haven't said the name,
right.
But it's Truvada, and it's 2 drugs in 1 pill, and it's a prescription medication. So
that's the key word, prescription medication.
Prescription medication is the key word. You are not supposed to share prescription medication. It is against the law to share your prescription medication. So the short answer is no. Also, you need to make sure that you go through the process to make sure that your liver function is up to speed for the medication. Your renal function is up to speed. Or when I say renal and hepatic, I'm saying kidney and liver.
Okay.
So it is important that you go and test, because they've been approved to take it does not mean that it's going to be okay for you to take it.
Right.
What's going on with you?
Right.
If you're also taking other prescription medications, there may be some interactions. So it's definitely important to make sure that you go through the process.
Right. Let's talk about PEP for a minute and the 72 hours. Okay. So let's say I had an encounter and the person called 2 days after we had this encounter and said, "Oh yeah, I forgot to tell you I was HIV positive." I wait a couple more hours. Let's say it's hour 69 or hour 70, and I'm coming in looking for PEP. How does that process go? And if I've really passed my 72 hours to take PEP, what happens then? How do I get help? How can the actual drug help me, or can it help me at that point?
Okay. So if you're at hour 69, you definitely need to make moves, and you need to be honest, and you need to let the people at the facility that you're working at, or that you're going to, you need to make sure that they know this is hour 69, so that it's some type of urgency put into their actions.
Right.
So you can get the medication. There are a couple different ways. So With some agencies, with the Department of Health, they have it on hand sometimes.
Okay.
Neighborhood Medical Center, I know you
Right.
work there. You guys have it
Right.
on hand. Bond, I believe, has it on hand as well, so you can literally get it that same day.
Mhm.
They literally just have to put your stuff in the system.
Right.
But again, that does take time. So we know you're on hour 69. We're going to do our part to make sure that
Right.
we're getting all this information in the system in a timely manner so that you can get the medication. But it is important that you go as soon as possible. Now, after that 72-hour period, if you kind of reach that point, to be honest, at that point, what you need to do is take an HIV test to make sure that you're negative. And then it's almost kind of like playing the waiting game.
Right.
You just need to kind of make sure, because there's no proof that if you take it after that 72-hour window,
Right.
it's going to work. So
Right.
no one is going to prescribe it to you if it's after that 72-hour window. And you just kind of have to wait and make sure that you're doing those follow-ups every 3 months to make sure that it hasn't, you haven't seroconverted, or the HIV hasn't, I guess, started making antibodies and antigens in your blood.
Right.
At that point, you can start on PrEP. So once you're not a candidate for PEP, now you've encountered this experience. It's after 72 hours. They're going to probably ask you, what are your behaviors? And then they may say you're a candidate for PrEP. So you need to be taking this indefinitely, not just, oh my gosh, it's a Plan B emergency sort of thing.
Right. Okay. So with that being said, because this is the PEP and PrEP is surrounding the prevention of the prevention of the transmission of HIV.
Mm-hmm.
So how can I recognize the early signs of HIV infection within my body, or how can anybody be able to recognize that?
So a lot of people don't have symptoms.
Okay.
So that's important to know. That's why it's important that you go and take initiative and, go to your doctor if you know that you've done something or that you've had unprotected sex.
Mm-hmm.
However, there are symptoms. So they're almost like flu-like symptoms. You may be a little fatigued, maybe some muscle soreness, some congestion. The only difference a little bit, I would say, it's not as much sneezing. When you have the flu, you're kind of more so sneezing. It won't necessarily be like that, but there are flu-like symptoms.
Right.
So whenever you feel some type of way, regardless of if you've had unprotected sex or not, I would hope that you would, take the steps to go to the doctor to get checked up. Don't just stay in the house and drink tea and think that it's going to make whatever it is go away. So, but it's more so like flu-like symptoms.
So, have you ever had, or do you know of, I want to say you as in you yourself, but from your research and your time working with PEP and PrEP and HIV prevention, do you know if there have been any times or any scenarios or physical or health environments or symptoms that could prevent PEP or PrEP from working the way it's supposed to work in the person's body?
So if a person has renal kidney function, if a person has kidney dysfunction, and their kidneys may not be working correctly, you're not supposed to start the medication anyway. But say if something happened and you had a kidney injury, and then now you already are taking the medication, you have some kidney dysfunction, it can kind of affect the way that the medication is metabolized and excreted in your body. So other than that, there are really no other health issues that you may have is that when you can't take, medication.
Okay.
Of course, you would have to check with your doctor to make sure you don't have any pre-existing conditions that could stop you, like if you have allergies or something like that. But for the most part, no, it's pretty tolerable.
Well, this has been a very, very, very enlightening conversation right here with Dr. Brianna Janae. So before we close it out, can you tell the people once again what you do and how people can get in contact with you for more information?
Yes, so you can email me if you guys have any questions about sexual health, HIV, any of those things. My email address is Brianna, BRIANA.Journee, JOURNEE @FAMU.edu. And you can catch me on campus or out in the community. I'm usually with Joe a lot, so
you're making a
you'll
difference.
find me.
And I want to thank everybody for tuning in, for viewing this. I want to thank Heaven 98.3 for allowing us this opportunity to come and talk about PEP and PrEP. We want to thank the Delta Sigma Theta. We want to thank Temple Fit. We also want to thank MACA and the Florida Department of Health for allowing us to have this opportunity to come in and talk about PEP and PrEP as we come up on World AIDS Day, which is December 1st. Again, we thank y'all for tuning in.